right, episode 61 of the Daily Knowledge Project. What I'm pointing to here is the anterior groin, or the front part here. This is a really common area. This is a really common area to have problems. A lot of people get like a pinching or a pulling in their hip. A lot of times you'll see that with like a deep squat or a lunge, or if you're going to catch a clean or something like this. This area gets completely misinterpreted as a hip flexor problem. So many people don't know what's really going on here. So if you find yourself squatting and getting a pinched in there, a pop or click in there, or discomfort in your hip, what you actually have is something a little more severe. Usually it's a degenerative type of component. And a lot of times what happens is over the years, as you put more wear and tear on your body, we see this in more athletic people that were very active, your body actually lays down more bone inside the joint, and now your joint can't move how it's supposed to. So it puts more pressure down in here through the hip cartilage in the joint itself. And people, especially doctors out there, misinterpret this all the time. They think that this is a hip flexor problem. In no way, shape, or form is that a hip flexor problem. It's actually something a lot worse. So if you find some popping and clicking in your hip, or a sharp type of stabbing pain, you probably have something a little more severe and need to get that evaluated by a proper doctor who specializes in biomechanics and getting at the full resolution for that problem, that injury. So this is not a hip flexor problem. This is actually something worse, some type of degeneration. So that's my knowledge project for today. We'll see you guys tomorrow.